Welcome back to another episode of Reading Rehab. I am Mike Brown, joined by
Brian Gardner
and Pat Healy.
And I'm hoping that first 2 seconds wasn't cut off because I just looking at the recording thing, it looked like my welcome back was cut off, but I'll only know in post in the
welcome
edits.
back anyways.
It's just right off the beginning. It's just come back. They just cut out the well. Just come back.
So we'll know that in an hour or two. But anyway, this week we are talking about an article called Comparison Between Eccentric and Concentric Muscle Actions on Hypertrophy, a Systematic Review and Meta-Analysis. This was published in the Journal of Strength and Conditioning Research in 2025 sometime. Hasn't been too far into the year, so had to have been pretty recent. I kind of wish they put something in the title about how this is like expanding on a previous thing, because they literally take all the same citations from a previous article by Schoenfeld et al. In 2017, and then just build on that. So I kind of wish that there was like a part 2 or something in this, or like updated thing. So
thank you for the initial work.
Yeah, exactly. Like something like, hey, you guys did a lot of the work for us. But still, anyway, something we talked about off air and we're joking about is this has 10 pages of table 1 and then 2 pages of table 2, and this is a 20-page article, so some long tables.
You could eat a whole Thanksgiving meal off this table, baby. Let me tell you. All right.
I was gonna say,
you've definitely been waiting to say that for
sure. And you bet your britches I did not read really anything on that table. So
well, I can guarantee you, I swear this might be one of the few times I dove like pretty deep into tables, because I was curious, because this goes off of a point that we talked about before recording. How many of these isokinetic interventions were done maximally? And most of them do state it, but then some others don't really state at like what percent of effort or if it was maximal. Because I think, we talked about off air that I personally think that's a big constituent for what we're looking at in the results. Like an eccentric is an eccentric, but you also have supramaximal eccentrics where that thing is moving you no matter what. And kind of like what Brian said, it's like, how many people are actually doing a quasi iso where you might be holding something for like 3 to 5 seconds and then you cannot hold it anymore, and it's pulling you just into that eccentric contraction? Probably not many.
Yeah. Probably not many, but it's also like within like who we are actually working with. I think we mentioned like how many times have you gone super maximal with a patient that comes into your clinic? I think again, I would say 0 for me.
Same.
But I think it comes down to like, this is more for me a performance side than anything else. Like a super maximal eccentric would be more from a performance side. And granted, like rehab, we also talk about like performance therapy and like performance. We're getting back to performance, but we also don't utilize this as much as we probably could. Like they talked about like pennation angles and changing morphology with eccentrics was like the main thing. but I don't think we actually get to that like eccentric. We go, okay, just do it nice and slow. We'll give you, here's 10 pounds, go for 5 seconds down. Are we really getting to that person's like super maximal strength capacity? Probably not. And
I
maybe that's
I
just
have
me.
yeah, I was gonna say I just thought of this as like potentially like a rebuttal slash like devil's advocate is we're talking about super maximal as our pure like 1 rep max strength, since that's like its definition, right?
Great.
But
Yeah, but greater than 1 rep max.
yeah, exactly, greater than 1 rep max. So like you're just slowly lowering loads or controlling loads greater than what you could move concentrically. But what if we think about super maximal instead of strength, but as in like tolerance? So potentially I just like as a for like an RDL, for example, maybe going through the concentric motion of an RDL with 100 pounds is painful for someone, but they can do just the eccentric um, with 140 pounds at the same level of pain. So like that would be super maximal um, for the pain threshold.
Yeah, I mean, you could look at it 2 ways, like whether the adaptation of what you're actually looking for from morphological standpoint or from symptom response standpoint. I think that's where you can kind of have 2 separate types of like thought process with that. Like, am I going for the adaptation of pronation angle and whatever, or am I just trying to take them so that they can lower the weight based on symptoms? That's the way I'm kind of looking at it as
Yeah.
you rebutted to the
Yeah.
I don't do this with a lot of patients from a physiological standpoint.
Yeah. And I mean, this paper, like to that point, is only looking at like the physiologic morphologic changes. So like my
Yeah.
rebuttal, it falls on deaf ears in this paper because it's not what they're looking at. Like
Yeah.
they specifically say they're looking at healthy populations.
Yeah. I was going to say, like,
Um,
they're looking at just healthy individuals, more just physically active, all RCTs. So, yeah, that's kind of where people aren't like hurt or experiencing pain at this point.
yeah. And I think this is good to know for people that are experiencing pain though, because you would expect that the physiologic or morphologic changes um, are the changes, right? Like that in theory. I think the assumption with this is that um, if it's happening in healthy tissue, it's probably happening in injured tissue. I guess we can't say that with 100% certainty. Um, but I know a lot of our goal in rehab is often hypertrophy, like muscle hypertrophy and strength gains. So if you're looking for muscle hypertrophy, like it would be good to know if eccentric or concentric is superior, which I guess we haven't actually said the results of this yet. Neither was found superior. So that's, I guess, freeing in the rehab sense of like I don't have to do a certain thing. Like um I don't have to get these people to super maximal loads um to still give hypertrophic benefits.
Muscles are dumb. They don't know. They don't know the difference.
Yeah. That's why we have a brain that controls them all.
Muscle don't know. They just respond to
Yeah.
metabolites.
Yeah, muscles just like do their thing. They're like, why
Yeah.
are you picking up this heavy thing? Stop.
They just cross bridges, right? No,
Nice.
but I think you bring up a good point to where, like to that, let's say you're in a clinic where you don't have all right, I think knee extension is just like the easiest because like planar movement. You'll have a knee extension, knee flexion machine. It's like, all right, well, what else can you do to increase metabolites for hypertrophy and just time under tension? Oh, let me do a, isometric. And if you have access to like any kind of inline dynamometer, I guess you could also do it with a push cell, but working at like a percentage and just sustaining that. So it's a long time under tension to accumulate metabolites for hypertrophy. And then where else was I going with this? That's about it, probably. Yeah, my mind just shut off.
Giving alternatives because not all of us have isokinetic to do super maximal.
Oh, well, okay. Yeah, to that point, I've done super maximal on isokinetic, and as you can expect, it sucks. But on the flip side, also, I think it to many performance outcomes, you either focus on the form at which you're doing it or you try to give more. And like, yes, these isokinetic devices are meant to have constraints to really like hold you down and keep you in your planar movement, or like really keep your form and like really achieve that end range eccentric. But
not to
I know,
compensate.
yeah, let me tell you, you still do.
Yeah.
Like, I know no matter how much I try to tighten down the thigh strap when I'm doing the super maximal knee flexion eccentric, my thigh is still just lifting off from the chair. And so like that moment arm is just changing. I mean, the axis of rotation is changing because my leg is moving, and then it's just becoming all weird. So it's challenging to even do those isokinetically at a maximal effort, just due to the fact that your body compensates and the constraints they can only do so much.
Well, it's also a risk reward too. It's like, okay, well, you put someone on there like yourself who's healthy and young and has really good tendons, and then you put on someone that isn't. Do you run the risk of like something detrimental to them? I mean, the potential of overloading that tendon. I mean, that's what happens when you rupture a tendon. You're getting to those thresholds of failure of the tendon.
Yeah.
Yeah, so what one thing I think is funny from this article is so like their main result, right? Like there's not really a difference between eccentrics or concentrics, but then they did so many subgroup analyses that like I guess one, they're bound to find something that's significant, and one of the things they found that was significant in favor of eccentrics was a training duration of less than 8 weeks, which I guess I feel like I'm jokingly conflating, but I could see potentially some people actually doing this is like, oh, if I'm trying to build muscle quick, like in less than 8 weeks, let's just like blast some eccentrics and then get huge. But then therefore you then have the risk of like potentially just um building up to these super maximal eccentrics like way too quickly and then just causing an injury because you were dumb in your training.
Well, I wonder if that's just because of that risk of injury increases after that 8 weeks. I mean, they don't go into like what happens
Yeah.
if you continue past this. I mean, they do go into other subgroups of greater than 12 weeks, like in the lower limb, I think was the other one.
Yeah.
Because they looked at revealed upper limb muscles less than 8 weeks for intervention, muscle thickness assessment, and isokinetic contraction benefited from eccentric training. Or did I read that wrong?
Where are you?
In discussion, the first paragraph. B.
Yeah.
Our main findings.
Yeah. My my understanding for B is that upper limb muscles are a different subgroup. Less than 8 weeks
Gotcha.
is a different subgroup, and then like so on.
Yeah.
So yeah, they're saying, I guess, eccentrics may work better for upper limbs than lower limbs is in theory the takeaway there.
Yeah. Which I think makes a little bit more sense, but
Yeah,
in my head.
Yeah, exactly. Like your upper limbs maybe aren't used to taking that much force like the legs are.
Right. And you need less force to create that super maximal
That's also true.
because they're not
Like
as like the cross sectional area is also a lot smaller compared to like my quad versus my rotator cuff.
Yeah.
Maybe I'll just do that for 8 weeks. I'll just do some super maximal, just
Then you won't be able
ER.
to fit through a door.
Just have this one shoulder that's just massive. Yeah.
We'll put that on Data Nerds. You can definitely put that up on there. We'll look at some serial testing from super
Oh my
maximal stuff.
No thanks.
You got 8 weeks. Here you go.
Yeah, exactly. Do it in less than 8 weeks. And that just makes me want to go into like, so looking at their table one, the like really long table, really the two things that I actually like looked at because they were the shortest was the subjects, like who was in it, and then the duration in weeks. And there's one study that was 4 weeks long. And the main finding from the study was the intervention did not promote effects on muscle size. Maybe that was just because it was 4 weeks. I thought it was like, I guess, a well-known phenomenon that it takes like 6 to 8 weeks for muscle hypertrophy to happen. So there's an assortment of articles that are. There was one that was 4 weeks, a couple that were 5 weeks, and a couple that were 6 weeks. And I'm like, you're probably just not doing it long enough to see any muscle size changes.
I wonder if that
Which
affected the
is
result. I wonder if that affected the results. You know what I mean? If you take those specific ones out, is there more to this than anything else? Or if, like you said, just kind of just take anything plus 6 weeks and then look at the difference in the analyses.
Yeah, exactly. And like, I'd be curious if people just run that same test back, the 4-week one, but do it for 8 to 10 weeks, and like, do you see changes then? Because maybe that's like, I guess, a false negative that like there's not really any change between those. But I don't know. I feel like this is a bigger area of growth in research, I guess, because from 2017 to now, which I guess it's 8 years.
Whoa.
Quick 8 years.
You guys were babies then.
Existential dread coming out of me. Sorry.
Yeah, that's there was another 11 articles in those 8 years. So maybe this is an area of further growth. I guess another qualm I had with the article, I think overall it was pretty good, but I wish they at least put in the results somewhere, like the meta-analysis change in cross-sectional area or something. Maybe they couldn't do it because there was so much heterogeneity. But I want to know, like, how much did cross-sectional area change? And maybe that's a different meta-analysis where then they look at timelines for things, right? Like so we have this 4-week one. There was no change in cross-sectional area. Then we have this 12-week one, and there was big changes in cross-sectional area. How much of that is because of just like time doing the program versus like the program methodology itself? I understand that's outside of the scope of this paper, so I'm just asking for too much.
Just want more. Just want more.
Yeah. Man, I'm also just looking at table 2, and table 2 is just a lot of yeses and nos. It's like me talking to my parents.
Gotta throw in some unclears. Yeah, I'm not sure. I mean, I think it goes down to that practical application. Again, they kind of just highlight that integrating both eccentric and concentric muscle actions in a comprehensive resisted training program is like needs to happen, which I think anybody that's in this field would agree with.
Yeah.
So it's just like also making sure that you don't just stay in the concentric, like adding eccentric focused exercise periodically will help those sort of athletes or individuals rehabbing from injury.
Yeah. And I could see, and they again talk about strength and conditioning as well, where then it's more sport performance, where again, maybe you're not necessarily implementing eccentrics specifically for hypertrophy, but there's other qualities of the eccentrics that you like, and that's why you're incorporating them. And if there is some hypertrophy, then like great, but that's not the like main thing. And I say that, and I don't have a good example of what that would be. So
Me neither, but gains. Muscles are dumb. Go hard, go to failure, gains. But I think like practically, if we're talking about like rehab setting, I feel like to Brian's point, it just adds in that layer of like, all right, just have a little bit of like the eccentric focus, have a little bit of the concentric, build out like comprehensively, and just know that like both of these should blend themselves to the results you're looking for. And not that like you have to be overly prescriptive on one or the other.
Yeah, again, just get close to failure, and you're probably going to get some hypertrophy and other nice things.
Yeah, just hit them with the do 3 sets, and then last set we're going all the way until you can't do anymore. Just so you check off your stimulus box.
3 sets of 10, but then the last 10 is actually another like 20 after that because they were way underloaded the first 2.
Which is more common than we think.
Yeah. Yep. But that's a whole other can of worms. Yeah, I feel like despite this article being 20 pages, there isn't a whole lot to talk about other than that.
Yeah, no, I got nothing else.
Yeah, nothing on my end either.
Yeah, I guess one other small qualm that I just realized when I was looking at table 3, among their subgroup analyses, they don't do male versus female. I don't know if they didn't have enough to do that, but they also did adults and then older adults, and there were only 2 studies that had older adults. If you look at table 1, there are some studies that are just females. So I'd be curious if there is some sort of sex difference too. I don't know. I'd like to know. Yeah, that's just small thing. Yeah, otherwise, if you guys are good, then I think we got a slightly shorter episode today.
Yeah.
Cool. All right. Well, as always, if you listen this far, we always appreciate a follow on Instagram and a nice review on Spotify, Apple Podcasts, or wherever you listen to your podcasts. Thanks.